The film you are about to view is a dramatization of the Rapid Response Team program established at children's hospitals and clinics. Launched as part of a national campaign, the Rapid Response Initiative was intended to save lives by bringing critical care expertise to patient bedsides at the first signs of deterioration. In this video, you will see a caregiver in the middle of the night working through a process of deciding whether or not to call for the Rapid Response Team. Courage to speak up and willingness to collaborate has and will continue to ensure that patients receive the care that they need and deserve.
Nice and quiet tonight. Just like I like it. I don't need any excitement tonight. What's going on? Vitals are okay, but she seems to be breathing a bit harder than yesterday. Is this something I should be worried about? When they're that young, they're so hard to read. I wonder how does she look now compared to earlier today?
I don't know. Something's just not right.
Have you noticed anything in particular?
Something's not right.
Parents are our partners, and we need to listen to them. If a parent thinks that something's not right, then something's not right, and it needs to be re-examined.
When is the doctor going to be in?
I talked with Dr. Siegel earlier. He'll be in at 8 this morning. I'll have him check in on Annalise right away.
Please, right away.
Mom probably hasn't slept in days, poor thing. I know what she means. Something doesn't seem quite right. What could I be missing? Is this normal? I wish I knew. Maybe my patient needs to be seen by the Rapid Response Team. It's so easy to miss something. Respiratory distress can progress quickly to respiratory failure. Things seem to happen on weekends and nights when fewer people are around. I'd hate to be crying wolf over nothing, but I'm the one responsible for this child. I can't just stand here and do nothing. If I'm wrong, I'm wrong. At least this baby will be all right. Should I call the Rapid Response Team? I'm unsure, but have a gut feeling. I don't want people to think that I'm not a good nurse. No, since there hasn't been any real change in the child's vital signs, I'm comfortable watching this for a little while longer. Mrs. Benson, I do think that Annalise is still okay. I do think we need to keep a close eye on her. I'll be back in 30 minutes to see if things have improved. In the meantime, I have her on a monitor that will alert us if her breathing changes. If things don't look any better in a while, I may ask for someone else to come and take a look with me. This child is not improving. Her breathing is more labored, and her saturations aren't any better. I can't put my finger on it, but my gut is telling me that we are on the wrong path. I wonder if they are busy in the PICU where the Rapid Response Team comes from. I wonder if I call, whether I will look silly or dumb.
The average patient who experiences a code blue has already been deteriorating for several hours before help is summoned. As a result, and far too often, by the time help arrives, irreversible injury has already occurred. We must do better. We need to redefine success. It's not about how hard we work. It's not about protecting our egos. It's not about maintaining control. Success is doing what's right for our patients. Once you accept this premise, making decisions becomes a whole lot easier. Like the one about whether or not to call a rapid response team. If you have concerns about your patient's condition, you call.
I know I'll be doing the right thing if I call. The child's mother noticed something 2 hours ago. I have done the watchful wait long enough. It's time to call. I just wanted to let you know that I'm not comfortable with how hard it is for Annalise to breathe. I am concerned. I want to do what is best for your child, so I'm going to have some of my colleagues come and take a look at her. You're welcome to stay. Do you have any questions before I do that? Hi, this is Kara Wilkie from 4100. Could you please send up the rapid response team? The patient's name is Annalise Benson.
I will notify them right away. They will be there in 5 minutes or less. While you're waiting, please get the child's chart and make sure that your charge nurse knows that we are on the way. Also, be ready to present your patient using ESPA when the team arrives. Thanks again for calling.
Hi, Kara. Can you tell me what's going on with this little girl?
Her respiratory rate's been increasing and her oxygen saturations have been decreasing.
We'll take a listen to her.
How much O2 is she on?
She's on almost 3 liters and she's not improving. Her mom's really concerned, and so am I.
Kara, I just want to tell you what a great job you did calling the rapid response team tonight. I heard from the PICU, and patient is doing better and should come back to us in a couple of days. I filled out a wow sticker for you for doing such a great job. Congratulations.
Thank you.
The decision to call a rapid response team is always a good decision.
You don't need anyone's permission to call.
Listen to a parent's concern. They know their child best.
In just 6 months, requests for the rapid response team are approaching 20 per month.
Code blues on med-surg floors have gone down since we implemented the program.
The survival rate of patients who experience a code has gone up.
If you're concerned, we're all concerned. Make the call.
Calling the rapid response team can save lives.
It's always the right call.